Sorry, food eater, not food expert here. If you look above, it says snacks may be included as part of the minimum diet. So, are we crossing over into meal planning? Because I understand that when I look at the regulation again, this is somebody is looking at a facility's diet and they need to have in this current regulation 14 grams or more of protein, and they have to have 2 servings a day. So are you saying and maybe I'm confusing the word entree, like if I got my protein in a hamburger, could I not then get some nuts? Or am I misunderstanding the word entree here?
I think it's just saying that it's a part of the calories. If you have a string cheese at snack time, that is going to count for the dairy group, and it could count towards the both protein and the actual dairy. It just depends on, the menu itself. And the dietitian knows when they're reviewing all that, they're reviewing the whole face of the menu and any other intake that may not be on the face of the menu. For example, those AM snacks, lunch snack that we're talking about, the dinner snack, some menus I've seen don't have everything that I mentioned. They just have breakfast, lunch, and dinner in a PM snack. So it just really depends on when the dietitian is reviewing the whole entire intake as a whole for the youth, which is could be 2 menus. But yeah, it should be the entree wording, protein group, and then that first line, snacks may be included as a part of minimum diet. It is a part of it. So I think hopefully I answer that question.
I agree with what Johnny said, because when I do inspections and also for the facility that I review the menus for, we provide a sandwich as part of their HS snack, which is the snack after the dinner. So because it's this whole sandwich, there is meat in it. So I will count the meat in that snack as part of their protein. But then they also have proteins at breakfast and at lunch and dinner. So I would include all of that as part of their protein group.
Thanks, Helen. Amanda?
Would it meet the needs if we clarify in the protein group paragraph that protein obtained through dairy group items are not to be counted towards the protein group? And my only hesitation with using the word entree is we don't have that term defined. We have meal defined, we have snack defined. If we're going to use a different term, it may be interpreted that I don't know if you're trying to be inclusive of both of those, but if that's the route we're going to have to call out the terms we already use. But if we're simply just trying to get across that dairy group protein shouldn't be counted towards protein servings, then maybe we should just call that out, or it may be clearer. I just worry about saying entree protein group. If we're meaning like it has to be through the meals and snacks, not necessarily a beverage. Because if we're not going to count the protein from milk, why would we count it from yogurt, which could be a snack, from the ice cream, from the pudding, from all these things that potentially have protein in them? If it's all dairy group items, we might just want to call out, like, we don't want these counted towards these servings, if that's the intention that I think I'm hearing.
I know this is adding more to the confusion, but if they've already satisfied their dairy requirement with milk and something else, and then they serve yogurt as a snack, technically, I could count the protein in that yogurt as part of the protein group. So I can't completely remove the dairy. What if we said meal protein group? Would that be helpful? Without using a new word. As you said, it hasn't been defined.
Well, I guess I wondered what was the problem with counting protein from milk if we can count protein from yogurt?
Well, because milk is so you cannot count one food in 2 separate groups. So if you're using the milk for your dairy requirement, then you cannot use the milk for your protein requirement. But if I'm not using the yogurt for my dairy requirement and it has protein, I could count it toward the protein requirement. Does that make sense?
Yes. I guess I don't understand what problem we're trying to solve then. If inspectors kind of know that that's what they can do, they know those nuances, is it necessary for facility managers have that spelled out in here?
The inspectors know, but sometimes the facility managers or even the dietitians get confused. And what they do is when they do the nutrient analysis for that day, they'll take a look at the total grams of protein from all the meals of that day. And they think, oh, it satisfied at 28 grams. When in fact, some of that protein is coming from the dairy, some of it is coming from the grains, and they're not all coming from the entree protein. And so when the inspectors go in there and they're looking at the amount of protein in the entree and they're saying, oh, you haven't satisfied the 28 grams, that's where the misunderstanding comes in.
So does that align with what you're describing? Like, because on here are the examples of proteins. It sounds like it can include some of these, like, the examples that you gave.
It can include it if you're not also using it to satisfy another requirement, the requirement of a different group. So when you do the nutrient analysis for the day, it's going to include the protein from the milk, for example, but you're counting the milk toward the dairy, so you cannot include that protein as part of the protein group. So that's why it's confusing. I understand that.
Thank you.
So if we can just come up with a word that can help clarify that protein group, that would be helpful. If not entree, I don't know if meal protein would do it, or if the group can come up with another word that would help to clear that up.
I was just gonna suggest the word main.
Helen, would that main suggestion kind of fit what it is that you're describing?
It works for me. I just want to make sure that it would be clear for other people looking at it, because I know what the guidelines are, but I know some people get confused by it. So if we are going to make a change, I want to make sure that that change becomes clear to other people as well. And the group is out there, they're the ones that are going to be looking at it. Is it clear to you guys if we put the word main in front of protein?
Thanks. Other thoughts, Carrie?
I think main may not be clarifying enough. However, if after the sentence where it says includes beef, veal, lamb, pork, poultry, fish, eggs, cooked dry beans, peas, lentils, nuts, peanut butter, and textured vegetable protein, if after that sentence it says dairy protein may be included only after dairy satisfaction or dairy group's been met, or dairy protein cannot be counted along as well as for meeting dairy requirements and protein requirements. Only one food requirement can be met per food. Maybe that might be a little more clarification. I don't know if that helped.
And sorry, Carrie, with the changes that Amanda just made on the screen, does that kind of capture your suggestions?
I'm sorry, were you talking to me?
Oh, I was asking Carrie if the
Oh,
edits that
okay.
Amanda was making kind of fit what you are
Yes.
sharing. Okay,
Yes.
thank you. And Helen?
I like that addition, but I'm not sure it'll capture the other protein that you might be getting from grains and so forth, because that's still going to show up on the nutrient analysis. I think that clarifies it to a certain degree, yes.
Should it be protein from other groups rather than calling out dairy groups specifically?
Hmm.
And also, does the language that's typed on there, now that I'm reading it again, it almost seems like you have to fulfill your dairy group first, but if you want to fulfill your protein group first, there's kind of restricts you from doing that. Or we can parking lot this, and maybe at the end, there's something that after we go through each group will make more sense to us as to what should and shouldn't be called out at the end, because it could be something, you know, all groups have to be met. You can't use one item to count for both groups, or, you know, something that's more summarizing rather than calling it out in each specific section we're going through.
I was going to suggest very quickly that if this doesn't work easily, then happy to parking lot it. Protein group meal shall include meal shall provide 2 servings of protein a day from these sources, and then like have includes beef, veal, lamb. So if at that where the cursor is, if it said meal shall provide what was it? The daily requirement should equal to 2 servings, at least. Sorry, the daily requirement should equal to 2 servings. Provide at least 2 servings of the following foods. And then that equal to a total of 196 grams per week, I guess, is what then I don't know if we're going to work on that. And then, yeah.
Okay. Thank you, Laura, for those edits. Do we want to look into the grams now and update what's shown on these regulations? Given the standards that we suggested on the previous paragraph? I'm gonna lean on my RDs for this.
I mean, I think this is like sort of are we talking about the ounce servings detailed in the dietary guidelines, or are we going to, and then we also need to specify grams for the DRIs. So I think it's, I mean, I'm okay to make those suggestions now, or to have it sort of like follow-up conversation about it.
Yeah, well, my question is, like, are we going to go with the DRIs, DGAs, and then are we going to include it here in this paragraph where we see the number of grams per day and then per week, or the serving per serving and then per week? And are those things that you would have access to, kind of like now to put it in the drafted language?
I'm actually okay with all of the serving sizes and all of that here, because as Johnny said, it does make it easier for some of the food service manager because it's all in one place for them. But if we want to be consistent with the adult, then let's remove that section.
So Amanda just struck it just so you guys can look and see if you wanted to keep it this way or not, and if we can get a consensus. So as it reads right now, just for section parens A, with the examples stricken, can we see if there's a consensus either to keep it or to strike it? Does anyone have not want it stricken? Okay. All right, so we'll go ahead and strike the examples, but leave the additions that were done in blue.
Thanks, Shay. If that's all for the protein group section, let's move on to subsection B.
Sorry, before you move on there, Laura, can you share that grams per day number with me again? For the protein?
Yeah. And do you want the link also
That would be
for
great.
the
Yes,
reference?
please.
Would that be helpful?
Yes, thank you.
Yeah. Actually, the link is maybe a little bit messy. So 56 grams per day. Sorry, 52 grams per day. I'm sorry, 52 grams for 14 to 18-year-olds.
Do you have a separate number or is it available for over 18?
Yep, and for over 18, for 19 to 30, it's 56 grams.
Should, I guess as a group, our SYTF youth only go up to 26. So do we want to still call out, or 25, do we still want to call out ages 19 to 30 or should we stop it at 25?
19 and older, I don't know.
Oh,
19 and older is good.
and I'll put a note that we need to update these grams per week. Does it have that information as well? If not, I can just do the multiplication later.
Sorry, that the 52 equals 364 per week. Or 392 for the older age. And I'm sorry, I'm feeling like the language I suggested at the very first sentence is a little confusing. I don't want each meal to include 2 servings, but maybe like daily meals shall provide at least 2 servings. Does that work?
I'm sorry, say that one more time.
Sure, if that sentence could start daily meals,
Thank you.
is that clear? To
I think it could be potentially confusing since the paragraph right before it says snacks can be part of the minimum diet, and then we have meals defined as something that's not a snack.
Mm,
I see some potential gray area confusion there if, you know, where they're
mhm.
counting protein from snacks as well.
Right, so I think it's like we're still maybe stuck on this, that we want the meals themselves to offer protein, but then knowing that there's going to be other amounts of protein from other food groups and snacks that are going to contribute to the daily total.
What if we put 2 servings of protein shall be offered daily to include the following?
I like it. And then in the following, since we were striking the examples below, I'd like to suggest adding tofu and seeds back or to the list of protein foods.
And Laura, was that all for the numbers that you were looking at? For those groups?
Yeah, I think that is correct for the total grams of protein for the, and just flagging for the group that that's like the higher level. It's like for females, there's like a lower protein amount, but that would be covered by meeting this higher protein level.
Quick question on the protein level, Laura. Is that like 52 grams or 56 grams of total protein for the day?
Correct. So I think we're still stuck in that just
Right.
wanting to clarify that the
Because
sorry,
that looks really confusing when you've got a minimum of 14 grams per serving and 2 servings, so that's 28 grams. And then all of a sudden you put 52 or 56 grams.
yeah, I think that the 1 serving equals 14 grams or more of protein should move 1 sentence up, so it comes immediately after the list of protein foods.
Just gonna move
Mhm.
that down for a moment. so
Yeah,
we-
that works too. Yep, very good.
But that
So that we're
52 or 56 gram is still total protein for the day, right?
that's right.
So technically your dairy protein and other protein could be part of that protein.
And should be, right?
Right. So that's why I'm saying when it's put in there like that, it might be a little bit confusing for someone who's doing menu planning because it reads like it's saying for the 14 to 18-year-old, they have to have 52 grams of protein from their entree protein. That would be how I would read it.
Johnny, did you have a question or a comment?
Under the protein group, 2 servings of protein shall be served, not offered.
Could it be so in the middle of the paragraph, 1 serving equals 14 grams or more of protein, period, and then total daily requirements shall meet the DRIs or list or include our gram numbers here, which I don't,
Yeah, I like the 1 serving equals 14 grams or more of protein, period. We don't need to add the daily requirement shall equal 2 servings because it's already noted up above.
yeah. Mm-hmm.
And then maybe just refer to DRI for total grams of protein requirement for specific age groups. Would that be sufficient?
Mm-hmm.
I also agree to include DRI specifically in this section so that folks know what is being referenced. right. That is very colorful on the screen. Are there any additional comments? I know we want to keep moving forward, but this has been a really great discussion, so thank you all. Does anyone oppose what's currently on here? Slowly trying to work towards consensus.
Kylie, just for your consideration, if we can have a break after we kind of come to a consensus on this one section.
For sure. Thank you, Shay. Yes, so
I don't oppose, I agree. I just wanted to add after tofu seeds, I added in the chat some protein tortillas. Just to really ethnically connect the young people to what they already eat outside of the juvenile justice detention facilities. And that would just be my comment.
I think tortillas is underneath our grain group.
Oh, I must have missed
Um,
that.
And I know we're taking out those recommendations, so I don't know if that would even helps. But I just did want to call that out.
Okay. Yeah, we can put it somewhere. I think it would be great.
maybe as a suggestion, I know the TVP is a protein alternative. So would it be helpful maybe to just include protein alternative in that section?
So, or other protein alternatives at the end, is that what you're saying?
Yeah. Are we still serving TVP inside of facilities?
What does that stand for? I'm sorry.
Textured vegetable protein?
And here also, I don't know if we want to speak to, sorry, quality of the protein, if we want to specify, I don't know, like whole or minimally processed proteins, or any limit on processed meat.
Yeah, Johnny?
Yeah, we don't, we only buy real meat. And you know, for the sake of quality, I think that should be removed. Since we're all talking about moving into healthier, you know, I think the and textured vegetable protein, you know, that sounds like more on the adult side because the fillers that they enhance their meals with. But I think this would be appreciated if we remove that because that is a quality part. That states right there that that's not quality food.
So the textured vegetable protein, might be a little bit of a vestige. It is intended to be a vegetarian or vegan alternative to meat. So I don't know, beef, veal, lamb, so on and so forth. I don't know if there's another, and we could figure that out. If there's another term, or somebody said like an alternative protein source. So I don't, and I also don't know if TVP is like a catch-all for any of the, it's all of the alternatives to protein that are not meat or processed. So, I'll just throw that out there. Again, number one, I don't know if it's a catch-all, and number two, if you want to keep in alternatives so that if, vegan or vegetarian diets are offered, that whatever that alternative is can be offered. And I'm gonna look it up right now.
I
And just
just
quick,
added it into the chat. You know, if we just specify vegetarian, I think it sounds more attractive, or vegan. But TVP, it just sounds like the meat extender. That's the first thing that comes to my mind is they're adding and filling with these into the regular meat. And that's what I believe the jail does. They buy soy beef items. We don't do that in the juvenile halls or treatment facilities. But that's just what the Wikipedia explanation for TVP is.
thanks, Johnny. Agreed. And just to kind of also address Allison's point, my suggestion for other protein alternatives was supposed to be the quote unquote catch-all. So I just wanted to add that there. But Carrie?
I agree. We don't use the texture protein anymore, but we do have now that the vegan market is open and there's more vegan alternatives. I think having the or other protein alternatives and just cross off the texture vegetable proteins will indicate the higher quality food, because the TVP is a very low quality food, and it would be great to have that off the board. We've never used it.
Yeah,
Thanks,
that's what I
Jen.
was gonna say too. Is just leave it as other protein alternatives and take out the TVP.
Thanks, Helen. And I still recall Laura's suggestion of including the quality of the protein somewhere here in this language. So maybe if it works for you, Laura, including the quality or 2 servings of quality protein shall be served daily.
I think that's like hard to assess and hard to evaluate. So I don't know that that's gonna. I think eliminating the TVP is helpful towards like the enhancing the quality. I think that it's helpful to have the catch-all, but worry that you could get sort of these like really highly processed, meat alternatives that can be really high in sodium and saturated fat, and hopefully the other nutrient requirements further down will limit those being available. But I'd say or other protein alternatives that list bean, pea, lentil, nut, or seed as the first ingredient could then ensure that those protein alternatives aren't these like highly processed meat alternatives.
Can you repeat those examples that you just mentioned?
Sure. So other protein alternatives that list as a first ingredient a bean, pea, lentil, nut, or seed.
Thanks, Laura.
Uh-huh.
Does that capture
Just-
what you said?
Also beans.
And I misspelled lentils.
I know I rattled that list off a lot. Sorry if it was. Great.
And Laura, was that and or?
The first ingredient of one of the or is correct there.
And I do
Mm.
also have a note for myself on our parking lot list here that the quality of food and, environmental impacts of that we'll pick that part up again in 1463 menu planning. I think we had decided we wanted to possibly bring that topic up again there.
Thanks, Amanda. All right, so given these changes on the protein group, have we reached consensus? I see head nods. All right. Well, if those are good, we've been instructed to take a break. And then when we come back, we'll jump back into the dairy group. How long would we take this break for? Shay or Allison?
Let's do a 10-minute break.
Great. So I'll see y'all back at 2:52.
Thank you.
Thanks. Shay, before we get started, I wanted to ask, is there a time that you wanted me to break for public comment?
We were just thinking that, Hyla. Yeah, absolutely. So currently it's 2:53. The public comment that we had at the beginning was just a few people. Would you like to hold about 15 minutes, Hyla, for public comment? So maybe stop at break at 3:45, or would you like to use break earlier to include time for public comment?
I'm not sure who's joining us on Zoom, so I want to make sure that there's space for enough folks to submit their public comment if they want to. Is there a way that we can kind of figure that out before we decide on how long?
Well, if I scroll through the rest of the section that we have to get through, there's really only a few short paragraphs. So there's the dairy group, vegetable fruit groups, grain groups. I already went through during break and took out all these examples, similar to protein group. We already went through calories, so I can't imagine we'll go through that again. So maybe we'll get through these next 4 paragraphs and then we can decide whether we want to do a public comment then, or if we have enough time to get through the next section. The next section is just 1 short paragraph also. So maybe reevaluate after we get through this section.
Okay,
I don't think it'll
sounds
take,
good.
or we can stop at 3:30 if it goes past that for public comment.
Okay, yeah, let's do that. I will try my best to keep an eye on the clock. So let's go ahead and start looking at B, dairy group here. I know there was some great discussion on the previous section, so maybe now is the time to also include some of that here. Yeah, Sochi.
Yeah, I just had a quick question. It states for the dairy group, milk shall be pasteurized or fortified with vitamin A and D for persons 9 to 8 years of age. Did we want that to change according to what we changed for the protein on the age part? I don't know if that's best practices, so that was just something I wanted to ask my colleagues.
Thanks, Sochi. Helen?
What if we just remove the part that you just highlighted and just leave it at all milk shall be pasteurized with and fortified with vitamins A and D, period?
I also want to emphasize that they mentioned pregnant women, so I don't want them to also be left out.
Are you suggesting similar to what we did in the last section where we specified like ages 14 to 18 and then 19 and older? Are you saying maybe there should be a separate serving size for ages 19 and older?
Something that will, I'm leaning on my experts that was similar on the protein group. Just yeah, I don't, that's just something that's coming across my head.
Do we know if the serving size is greater than 4 for ages 19 and older?
It's
Yeah.
actually the number of servings,
It's
not
actually
servings.
reduced, yeah.
It's actually 3 for all of the calorie ranges that we are looking at.
Mhm. I think what's there, it's pretty much the guideline. Because it is for 9 to 18 pregnant and lactating women that the dairy requirement is for.
So do we need any of that information before for persons 9 to 18, including pregnant and lactating, or would it be accurate to say the daily requirement is 4 servings, period? If there's not anything more for anyone who's older.
Sorry, it's actually 3 servings for this entire population, including pregnant and lactating.
So do we want to reduce that from 4 to 3 then? Or do we want to keep it up? Realizing that you said it's supposed to be 3. There's no negative implications by reducing that.
I
I
just
thought,
I just wanted to make a comment on that. It's always been 4 though.
yeah, I thought it was 4 also.
And that's where I'm kind of confused of where were you referencing, Laura? I just want to make sure we're all in.
Is that a California thing?
I'm looking in the dietary guidelines and the 2020, 2025 DGAs.
Oh, but are we following the DRI?
So we just have a higher standard in our regulations, it sounds like.
Yeah, because it's always been 4, from my understanding. I've never seen nothing, no other digit, no other numbers.
So does anybody oppose just making this sentence the daily requirement is 4 servings without specifying an age group or pregnant or not pregnant? And then not reducing it from 4 to 3, or do people want to see that reduced? Seems
I
like
don't-
we're already holding ourselves to the standard of 4, so.
Yeah.
May I ask a question? This is Allison from BSCC. The um specifics, like a serving is equivalent to 8 ounces of fluid milk and 4 servings, things like that. Are those are coming from the DGA or the DRIs? Is that correct?
From the DGAs give servings of foods to make up a healthy dietary pattern versus the DRIs give specific amounts of macro and micronutrients. So like how much protein per day, how much calcium per day, how much sodium per day. So they work together. So the servings of foods in the DGAs supports meeting the nutrients in the DRIs.
Is it possible to request that one of the dietitians provided the updated numbers and then we can incorporate them? I mean, I foresee having a second meeting. If these numbers are established somewhere and we could maybe get those and plug them in and then go back over them in a separate meeting, that maybe we could address some of the other issues in the regulation or the other regulations. That's just a Allison thinking out loud suggestion. And I just want to make sure that that's okay, or those are numbers that are established somewhere, rather than if it's not something the group needs to discuss because they're established somewhere, just to use the rest of our time as well as we could.
I saw some head shaking, like it looked like some
Yes.
agreement out here. So is it something that we could look that maybe people who have a subject matter expert on these specific requirements that could maybe volunteer to look at these specific sections, which is A, B, C, D, and craft and put in the exact things that are needed for the next meeting? Therefore that we don't have to look anywhere else, but we can just look at it for consensus? Be more head shaking, like, yes. Who wants to volunteer?
I can take a stab at doing that. I'd be happy to.
Laura, that was wonderful. We were like, Laura, yeah, this would be great. So, Hyla, it does look like we're going to have another meeting, and this is something we're going to have to try to coordinate everyone together. So, we would be in touch with you, Laura, to what we are specifically needing and what time frames, and then we can have that ready to go by our next meeting. Okay, Hyla,
Perfect.
is that something that we could agree upon perhaps as a group, as a consensus?
Yeah, is everyone okay with that plan? And then we can move on to another regulation. I see head nods too. Okay.
Thank you, Laura.
Thanks, Laura. All right. So next section is C. I don't think that there's necessarily language there. I don't know, we're moving really fast, but I just want to make sure we're not missing other things that maybe folks want to talk about if it's not related to the serving sizes or the servings per day. Okay.
Carrie, I saw your hand.
Sorry, I had trouble unmuting. I did want to look at, because the vegetable and the fruit group is grouped together, and I feel it would be more beneficial to separate those into 2 separate groups. So that way the youth get a full nutrition out of both things instead of them being grouped together. And then I assume since the serving size is going to be looked at later, because the half a cup of fruit or vegetable isn't current standards, but to definitely separate the fruit from the vegetables.
Thanks,
Thank you.
Carrie. And that is something that we also heard from public comment as well. So thanks for bringing that up. And Sochi's also in agreement. Great. All right. Any other comments on this section here? Okay, then pushing forward to section D. Grain group we have here, and then to Sochi, your point earlier about the tortillas, they are reflected here as well. Something that if there are no hands up, would like to also suggest, if this isn't already on your radar, Laura, but having some specific numbers for the whole grains, either per day or per week as well.
Yeah, that's also on, definitely is on my list also. It seems like there's some language towards it, but it was unclear to me. So yeah, I think clarifying the daily number of servings and that and I would propose that like 50% of the daily servings are whole grain, and which is in line with the DGAs and the National School Lunch and Breakfast Programs. Actually, it's a little bit less than the National School Lunch and Breakfast Programs, but I think works for a 3-meal-a-day site.
Thanks, Laura. Carrie?
I'd like to suggest to maybe add some definition on what constitutes as a whole grain, sort of like we did with the vegetable protein alternatives. Because there's a lot, even within the school nutrition program, there's a lot of confusion on what's truly a whole grain versus an enriched grain. So like we did with the alternative protein, is list what would be the first ingredients to be considered a whole grain, or how much of the grain is whole grain to be considered a whole grain, because that is even a source of confusion in the school nutrition program as well. They have an exhibit B, or no, exhibit A that helps define it, but that's just a resource to be able to help define it here as well, just because there has been confusion with it.
Thanks, Carrie. Laura?
Yeah, I know that that's super confusing for all different kinds of programs that I support implementing various different nutrition requirements with. In New York City, we have been using that the first ingredient in the ingredients list is a whole grain, so that it's whole grain wheat, like it's whole wheat flour, brown rice, whole corn, whole oats, for example. That way you don't have to get a product formulation statement about the percentage of grains. So the information's available on the package information that's already there. So I would propose that that works here, but I know that there's other ways to calculate whole grains.
Thanks, Laura. And it looks like Amanda's making note of that as well. All right. Thanks. Okay. So did we want to list out those things at this point? I know, Laura, you had some examples. Do we want to include that in some track changes?
For the, I mean, in terms of the servings,
The whole grain definition?
yeah, I can repeat those or drop them in the chat if that would be easier. Pull out my language, so I haven't really.
Just a suggestion, perhaps this is something that Laura could work on as she's looking at the other ones, to add those alternatives that we can bring back to the group.
Okay. Yeah. Does that work then, Laura?
Yeah, that's easy. No
Awesome.
problem.
Thank you. And sorry not to put you on the spot or anything, but all right. If there are no other comments on section D, we've already gone through section E in pretty good detail, I think. Okay. So now that we've reached the end of 1461,
Very quickly, can I ask on E, if this is a place to consider the recommendation from the Orange County Juvenile Justice Commission around condiments. I'm not sure if condiments show up elsewhere. I didn't see them anywhere else, but in E, there's a mention of herbs and spices. And I think the Orange County JJC was sort of making the point around culturally appropriate food seasonings, and I thought this might, and condiments, and thought this might be a place to include their recommendation there.
Yeah, thanks, Meredith. So your suggestion is to keep it under the calories section versus say like the menu section?
That's where it seems to live here currently. I can see it going elsewhere. It's just sort of, they were making the same point that this section is making around like appeal of food. I get that here it's kind of couched in like how to make food taste good when it's like calorie limited, but I think it could also go in menu, but maybe all of it then gets captured together, and making sure that it's, you know, I'm trying to think of the right way to capture like a variety of like culturally responsive condiments. So, you know, different types of seasonings, hot sauces, that kind of stuff.
So from what you see here, is there a recommendation to add some of that like culturally relevant herbs, spices, and other condiments?
And you may also want to consider that it seems like it may also fall within 1463, since it already does refer to culture and ethical makeup. Maybe somewhere else where it can live, not just referring to the foods as that way, but also maybe adding and condiments or whatever words we come up when we get there, but it may also live in 1463 too.
Sounds good.
Yeah, Laura.
I know this section is titled calories, but it also references a saturated fat limit in number 2. So actually, I don't know if it should be called something other than calories, like nutrient requirements. And then have 1, calories, 2, pregnant youth, 3, chronic disease prevention goals.
Yeah, I think we can play with that because even the herbs and spices, and like you said, the saturated fat doesn't quite fit underneath that. So it may just need to be moved out to be its own
Right.
requirement, not underneath calories or something. Yeah. Seems weird.
Yeah, great. And then below the saturated fat recommendation, it also has mentions like reducing added sugar and sodium levels. And so I would propose putting in target numbers. So like less than 10% of calories from added sugars, which is in line with the DGA. And sodium limit that's in line with the calorie range that we're suggesting.
But Laura, no pressure, but is it something that while you're looking at those other sections A through D, could you also look at this for those targeted numbers?
Yeah, definitely. I just wanted to flag that there was like more that I wanted to do before, you know, that I don't come back with something other than what we discussed right now.
Thank you. No, thank you for doing that.
Yeah. And then similarly, I would suggest if we're introducing an added sugar limit, I'm also going to propose a limit on low and no calorie sweeteners or artificial non-nutritive sweeteners that we're seeing more and more of those being used as as companies are reformulating to reduce sugars, that they might be replacing them with non-nutritive sweeteners, which are not recommended for people under age 18.
Thanks, Laura. For formatting as well, I just wanted to add that under section C, vegetable fruit group, there are 2 areas where we talk about vitamin C and then the milligrams and then as well as vitamin A. So I'm thinking that now those should kind of be housed in this section here when we're talking about these limits.
Yeah, I think that makes sense, and maybe is like worth saying that the menu provides the DRI for micronutrients, and that might be, but I don't know if Johnny or Helen would prefer something more detailed in the regulation.
I'm not too sure about that regulation off the top of my head. Yeah, I'm not a dietitian and I don't have that on me right now.
Sure, I can put that, I'll put that draft language together and then we can see when we meet again if that works.
Okay.
That sounds good. Yeah. I'm not quite clear what you guys want to do, where you want to move what.
Okay. So if there are no other suggestions for the calorie section, are we okay to move forward to 1462 medical diets? See head nods nodding. All right. So then 1462 medical diets. I know it's a short paragraph, so we'll just give a little bit of time to review and then open it up for comments. Okay, so there were no SYTF recommendations, but there was a comment to update to reflect International Dysphagia Diet Standardization Initiative requirements on how food is rated when diets require food to be pureed, minced, soft, bite-sized, etc., to ensure consistency of food for diets because IDDSI is a universal standard. So comments on this section? Johnny.
The first sentence, only the attending physician shall prescribe a medical diet. You know, we do not have a physician on site 24/7. So I kind of feel like the supervising nurse that makes the call, when depending on the time, they're reviewing the diet prescribed. The physician then will sign off on the actual diet order that was recommended by their supervising nurse within 72 hours is what the regulation should be. I don't know if this is covering a different location in this Article 9, but I don't know if the physician should be only, the word only.
Thanks, Johnny. Marguerite?
I know we have a physician's assistant here, or I'm sorry, a nurse practitioner who's on site 5 days a week. And then we have nursing on the other. In addition, we have coverage with 2 more full-time nurses. Always, though, there's a oversight of a physician who's not on site but who will do authorizations or agreements or review certain things. So maybe in this case, it's in collaboration or in conversation, or it's something that's to say in working with the physician, that someone that's the only situation where a medical diet can be prescribed by the oversight of a physician. So not maybe saying, maybe having a verbiage in there, and I'm not knowing what to exactly say right now, but I know our nurse practitioner will go ahead and put a youth on a medical diet, but they're always consulting. So maybe in consultation with the physician, or only in consultation with the attending or oversight of a physician shall a medical diet be prescribed. Because in my understanding, every single facility has oversight of a physician. It's not just nurses or nurse practitioner or physician assistant. There has to be an MD who oversees the entire medical department in the juvenile hall. So just something to think about, because I would not want nurses to continue to just go on their own to start making medical a prescribed medical diet, especially when some of the nurses don't have the ability to prescribe medication, if that makes any sense. So now I might be rambling.
Thanks, Marguerite. So based on your suggestion, you wanted to strengthen the language by like what changes?
Maybe in only the attending physician or in consultation with the physician shall a medical diet be prescribed.
But if that person who's consulting with the physician doesn't have the legal authority to prescribe, we're kind of hung up on that word prescribe, prescription. I think that's why the physician part is there. Even if I'm consulting with someone, I'm the nurse's assistant or what it may be, would it be confusing to say, well, I consulted with them, but still technically that person has to do the prescription?
Yeah, and a nursing assistant can't prescribe. A nurse can't even write a prescription. A physician's assistant or a nurse practitioner can. And so if we're using the strong thing of a prescribed medical diet, it's not medication. So maybe prescribe is too strong of a word, because that's going to be getting in the way of being confused with medication that is prescribed, because there's not going to be anything inside this diet that a nutritionist couldn't put a youth on. So I'm not a nutritionist, so I may just refer to my nutrition specialist, but I do think there needs some medical oversight with justification.
That's Marguerite. Helen?
What if we change the wording to say something like only approved medical professionals, comma, in consultation with the attending physician, comma, shall prescribe a medical diet?
Only approved?
Only approved medical professionals.
Adults, what are they doing?
In consultation with the attending physician.
Ooh,
The attending.
What about using the term healthcare provider? That's the term that's used in definitions to cover people that are licensed and can include a physician, a nurse practitioner, registered nurse, so on and so forth.
So I just
Is-
looked up the USDA NSLP medical statement that we utilize, and I put in the chat. That's what it states who can actually prescribe, approve the medical um, diets.
Healthcare provider or health administrator?
And Johnny, is
Oh.
there a specific definition of medical diet? Because I don't want to start going,
So medical diets, those are therapeutic. Those are not just, that has nothing to do with vegan, vegetarian, finger
Mhm.
foods. It has only thing to do with restrictions. 1,800 calorie diabetics, 2 grams NAs. I'll let the dietitians chime in more. I'm pretty sure I missed a lot, but yeah.
No, you got most of it, Johnny. Thank you. Yeah, basically medical diets are therapeutic diets needed for certain chronic illnesses. That's so, yeah, it's not vegetarian, it's not vegan by preference, it's not religious. So it's therapeutic by nature.
I see Sochi's comment in the chat. Should we also look into a medical diet definition? Sochi, did you mean
What-
to define it in the standards?
Yeah, just to kind of report what my colleagues are saying. So when BSCC comes and inspects as well, it's also a distinction.
I'm gonna make a couple recommendations. I'm gonna take a little bit of a deep breath first. So the statement only somebody can prescribe a medical diet is tricky because our facilities still need to follow community standards for healthcare. So one of the things to remember is that, Title 15 is one layer on top of what a healthcare provider is doing at a facility. So what I don't know, again, food enjoyer, not expert, if a medical diet is something that is prescribed, and again, this is a question for people out there in facilities. The agency medical policy is going to dictate who prescribes it. I don't think Title 15 should be dictating who prescribes a medical diet because they're guaranteed there is some other community healthcare standard that says who can prescribe a medical diet. So I don't know that we should be focused so much on who prescribes it. Of concern for me is that if a young person has a medical diet, it must be followed, right? That's really what we're looking at here. So a young person is prescribed a medical diet, and just I'm kind of riffing here, so work with me because that wouldn't be in regulation. A young person is prescribed a medical diet. The dietitian or whoever is providing the meal planning and service at the facility needs to figure out exactly what that young person needs to eat. So that's the next level. And then the young person has to be delivered that diet. So some of these regulations are very, very old and contain language that's been around since CYA had these regulations. So when I look at this regulation, I could see it being rewritten along the lines of what I hear people saying. We're not so much saying Title 15 dictates who prescribes the medical diet. The bottom line is if a young person is prescribed a medical diet, it must be followed, it must be given, and it must be given in collaboration with whatever the medical provider standards are. I hope that helps. Might need a little working. Over the years, we really have pulled apart and rewritten these regulations so they make a little bit more sense. But I really struggle with Title 15 saying only this person can prescribe a diet, because I don't feel comfortable saying that. The agency is going to have to be figuring out, like, once they get a medical diet, they have to follow it. There's laws that surround that. That's my 5.5 cents. I don't know if it helps, but this is a lot of words. And it could be maybe made more efficient and narrow toward what we're trying to achieve here. That youth that need them, get them, and there's no deviation.
Thanks, Allison. So what I'm hearing from you is a suggestion to strike the first sentence.
Perhaps a medical diet provided, or a medical diet provided by a healthcare provider shall be followed by the, you know, something that would be said, that what Allison's trying to say, if there's a diet, you got to follow it. So if a youth has a diet, just making sure it's followed. And that's easy to inspect for. So if there's a diet, did they get it? Yes or no?
And I have one more question for the dietitians, and I know that we're running a little bit out of time. Where it says the medical diets utilized by a facility shall be planned, prepared, and served with consultation of the registered dietitian, are medical diets individualized?
For Orange County, I have a kind of like a medical diet manual for probation, and I work with the medical director to determine what basically are the medical diets that they need,
Mhm.
and then I develop menus based on that need. Sorry, my voice is going. So yes, we do have specific medical diets. We try to individualize if it's necessary, but oftentimes it may not be. Like, for example, I have a sliding scale carb count diet for them so that they can adjust per meal the carb level for those youth that need to be on diabetic diet. So that would be more or less an individualized diet, but it's not necessarily individualized. I'm thinking of the wordings here. If we strike out the first sentence and then just start with prescribed medical diets utilized by a facility shall be planned, prepared, and served with the consultation of a registered dietitian.
Oh, that's nice.
Thanks for that suggestion, Helen. And so she included another comment in the chat to also address allergies in this section as well, or at least in the definition of medical diet. Is this the right place for this to be included? My RDs.
So I don't know about other facilities, but for my facilities, allergy diets kind of fall under medical diets. So it's really up to medical to determine what their allergies are, and then they will prescribe the diet accordingly. So it kind of falls under that. I don't know that it needs to be addressed as a separate category. I don't know, what's the group's feeling on that?
Carrie?
Same here. The medical department issues any diets, including all allergy diets, and then it's considered a prescribed diet that we follow. So it's covered under this statement here.
Thanks, Carrie. Donnie?
Yeah, actually, I was gonna say exactly what you mentioned. Those diet orders, regardless of what they are, they come from medical, the nurses, and sometimes they're just allergies, finger foods. We might get one even though that's an officer basically call. We still find them coming from medical, which is the nurses. So yeah, I think it fits in the section pretty well.
Thanks, Johnny. And for the work group members that work closely with the youth, is it pretty common knowledge that if they do experience any kind of food allergies, that it would be considered a medical diet? Or does it need to say in this section allergy so that folks know?
I think for me, it can go both ways. We either add a definition of what do we mean, or like what's the standard of medical diet. Or we can just add after medical diet or allergy prescribed for youth, just to be clear. But I do agree with everyone else that medical diet sometimes it can be an allergy, or it can be something in relationship to a youth coming down from something, or pregnant youth. Yeah, those are just my thoughts.
I agree.
Thanks, Sochi and Jordan. So, oh, okay, Johnny.
I mean, we can put just, I wouldn't change 1462, medical diets, this, the title. I would add under the part where it says, prescribed medical diets, and then put a and or restrictions, because it could be just a restriction word. I don't know what does the dietitians usually hear? Is it admit? Is it restrictions? Is it because we call them diet restrictions, even though they're allergies. So it just depends on what the group wants to see here. We can add it, because it is prescribed. It's doesn't require, I mean, we don't have to have a signature for an allergy. We believe them, and we follow what the medical states, but they all sign off these documents, and so we treat them the same as a medical diet. So we can put prescribed medical diets in the first sentence, and or restricted meals or allergies. We can spell it out. I'm in favor of anything that specifies.
My hesitation with specifying allergies is we're not specifying anything else that could fall underneath that very wide therapeutic umbrella.
I feel like restrictions would be like good because it's like it's like broad, and it's like covered through like from the doctor, you know.
Thanks, Jordan. So, Amanda, I heard you say that I'm sorry, can you repeat that again?
Yeah, I'm hesitant on calling out allergies specifically if we're not going to call out diabetics and anything else that can fall under that very large and forever evolving umbrella of being therapeutic. Because it could potentially, if I looked at it and all of a sudden that was added, it could potentially make me question if what I thought was therapeutic is therapeutic, and I think that's going to vary by facility. I just worry that throwing that word out there and leaving only that word out there could be confusing. And Sochi, maybe if you can remind me, I think from your experience, how did you come to learn about your allergy? Like, did something happen and then the facility had to go through a process to do this medical diet?
Yeah, I'm just thinking about, my experience. I didn't know that I was allergic to gluten until I had to talk to the nurse, and the nurse actually told me, she was like, yeah, let's do some testing. So I know one of my colleagues did mention that when we do learn about it, when the facility does learn about an allergy, that the facility does do some testing. But then when I was sitting in the units, and even when I talk to the young ladies now, a medical diet is kind of like you said, kind of like a broad term. But then also I think it would be really helpful if we add it as like in the definition section, just so it can be helpful so we understand kind of like what we mean when we use the term medical diet. Because I seen young women come in, and I see them now, they're coming down from stuff. So that is a medical diet, that the facility kind of puts a restriction on the foods that they can take because they're coming down off of a substance or something, so they have to only eat bone broth so they can get those nutrients back. and they are restricted from the hard foods at that time, because then their body won't process it, and that's according to what the facility does. So even I do agree, like maybe not change the term or add allergy because it won't honor the already the broad term of medical diet. So maybe it can be beneficial for us to and easy for the BSAC inspectors to have a definition of what do we mean by medical diet according to all the different diversity of youth that come into the facility that do have different medical diets according to how they're coming in and what the nurse or the physician or the expert in that field determines whether a young person meets this medical diet.
And maybe Helen or Johnny might be able to answer this part. The medical diet manuals, do those typically have a definition for that the facilities come up with for a medical diet?
Basically, it's a therapeutic diet. That's what it says. I just want to be clear. I'm understanding this because everything that you're saying, Sochio, seems to indicate that whether it was your allergy or another youth's allergy coming through, they still go through medical. Am I correct? Because that's how you discover that maybe
Correct.
right? So then ultimately it's still medical that prescribes the medical diets. So I'm just thinking out loud that this still falls under medical diet. So is there really a need to separate out medical diet from allergy? Because
I'm sorry, yeah.
falls within medical diets, right?
No, we don't need to separate it. I just think that we should add a definition.
And that's something I can, if it's okay with the group, I'll put that in our parking lot because we will have a medical mental health work group as well. So that's something we can ask them to consider so that we can take this input, their input, and maybe come up with something after that. So it may not be something you see right away, but if that's something this group would like us to ask the other group, we'd be happy to do it.
I would vote yes.
And I just want to chime in with the time. We're currently at 3:40 and we still want to make time for public comment before we conclude for the day. And then in addition, choosing a second meeting.
Thanks, Shay. Is that something we wanted to decide on this call?
We can submit emails afterwards. I'm sure it's gonna be difficult for everyone to try to coordinate their calendars, but we just want to put it on the horizon that this is gonna come and that we're gonna need a second work group.
Okay, thanks, Shay. So I want to ask the group, do we want to finish this regulation here or move over to public comment? I know we only have a few more sentences on this section, but could be lengthy.
I think we should allow for public comments because there's not a lot of time left for them.
Yeah. Okay. Public comment. Thanks, Jordan. All right.
Okay, so what I will do is I'll go ahead and reread the statement for public comment so everyone is clear. Just want to let everyone know that there will be additional times for public comment besides just this meeting. There'll be public comment at the next nutrition work group meeting that we have, as well as when the ESC reviews the Title 15 regulation revisions, when the ESC finalizes the proposed revisions, when the BSCC board approves final revisions, and during the Office of Administrative Law 45-day public comment. And Amanda, can you go ahead? Oh, she's got it. All right, we got the public comment slide. The purpose of public comment is to seek input on decisions that are being made on nutrition regulations. Please try to keep your comments focused on this work. Members and BSCC staff will not respond to public comments. We're going to take the Zoom attendees' comments. Please raise your hand if you're in the Zoom, or if you're participating by phone, do *9. Comments will be limited to 2 minutes, affirming and not repeating someone else's comment. A countdown timer will be displayed as a visual aid to commentators. Please be mindful of the time you have remaining for your comment. You may also want to submit your comment in writing to regulations@bscc.ca.gov. Do any of the members have any questions about the public comment that we're going to take?
Okay. So we're going to begin public comment.
As of right now, we have a few people raising their hands for public comment. We're going to start off with Colin Ford from Fly.
Hi, good afternoon. This is Colin Ford, Director of Policy at Fly. First of all, thank you to this working group for your work today. I've got one comment on a topic you discussed and two comments on pieces of Article 9 you haven't reached yet. First, for the vegan and vegetarian food, I'd strongly recommend that you move forward with a change that you discussed, and that being adding a time requirement for the facility to honor a request for vegan and vegetarian food. I spoke with a young person actually just yesterday who had to wait multiple weeks for her request to be honored. In the meantime, she had requested a vegan diet and was being served bologna sandwiches at lunch and only eating the bread. We need to make sure that the regulations are strong and prevent these types of situations. I also think that religious diets should be added in this section as well. Next, a key recommendation that Fly Youth have uplifted in Article 9 is finding a way to connect food and nutrition with job skills and personal development. I think Section 1465 could be a chance to add a requirement that youth be able to take advantage of the food handler certification process that staff are required to complete. I think it's a great chance for youth to gain a skill and a certification that they can actually use when they're going through reentry, right? There's a lot of jobs in the food service industry. Last, I'm really excited for you all to get to the meal and the menu planning next time. I think there's a ton of potential in this section to meaningfully include youth in the meal and menu planning process. This is a chance for youth to learn about eating a healthy and nutritious diet, have a sense of ownership over the food that they're being served. I think there's a chance to create menu planning committees. Youth could be regular surveyed, or there could be some way for youth to vote on what they're eating. Thanks again, and thanks for your consideration.
Okay. Next, we have Israel from CYCJ.
Israel Villa with CYCJ. Foremost, thank you for a great morning, afternoon, and overall positive trajectory thus far. I want to encourage you to continue to lead with your hearts and collective solutions versus any obstacles or challenges. I also want to challenge y'all to be innovative. Up until CYCJ's involvement with this process in 2017, these minimum standards have not been adjusted much for decades. I also want to acknowledge the balance of expertise of this work group, as well as the importance and need for balance among system and community stakeholders in these and all work groups and ESCs under the BSCC. With that being said, water is not mentioned. I suggest that you add that youth must have access to clean, filtered, and or bottled water. Youth have also shared that the water from drinking fountain attached to the toilet is not clean and animalistic. I'm very familiar with the stainless steel sink/toilets and have to say that I agree with the young people. I encourage you to update Section 461 to remove the ability for probation to deny a request for vegan meals. Vegan/vegetarian food should be approved immediately or as soon as possible, and agree that clear protocols and documentation for any denials, as well as a comprehensive and clear appeals process, be established. Under Section 1465, in full support of Colin's points around creating opportunity and pathway for youth to receive training and certification in safe food handling. Lastly, it sounds like we have system stakeholders here from some good counties, but I want to remind us that these minimum standards apply to all county juvenile facilities. And unfortunately, we know that there are many bad counties and horrible facilities. Thus, uniformity and alignment is absolutely necessary and critical. Thank you.
Okay. Next, we have Ben Amador.
Hi, thank you for your time. Ben Amador, community member. I grew up in juvenile halls in a state prison, and I personally, along with people there that I was with, remember drinking cups of water from the sink just to feel full while waiting at a steel door for food like a dog. So let's not get caught up in the terminology and use common sense here, please. Let these kids talk during meals and give them more time to eat. To this day, my wife tells me that I eat like a prisoner because how you guys literally trained me to eat like a dog. And give them at least 2 meals a day. These kids are humans too, not animals. Let's not get two hot meals a day. These kids are humans too, not animals. Let's not get too scared by the words on demand. If these kids are still hungry throughout the day, give them another snack or stack lunch and make the meals bigger with better food. You have the funding for it. These kids are growing, working out, playing physical games. They're hungry. I was hungry. And they're also not just kids. They're going up to 25 years old, right? So let's not just give them the bare minimum. And food should never be used as leverage of power over hungry kids. That's just sick. I'm sure everyone here can agree on that. And if these kids are gaining weight with the small portions, then give them more stuff to do so they're not just sitting around, and give them better food. I appreciate that you guys supported all this with your recommendations, and I just hope that this common sense stuff gets approved. Thank you.
That is all for public comment on Zoom.
Kylie, I'm going to pass this to you for some next steps and to adjourn.
Thanks, Shay. So again, thank you everyone for all of your time and expertise today, and thank you to the community for those public comments, especially those who have stuck with us the whole day. So next steps, we will be having to reschedule or schedule for another meeting to kind of pick up our discussion where we left off. I'm not sure, Shay, are we going to try to have an ESC meeting before the work groups meet?
The ESC will meet after the work groups meet. This is the first of 4 work groups. It's taking us some time to get through them, and most of them will probably meet 1 or 2 days. So we really need to get these groups, the work groups, done so that when the ESC meets again, we can provide them with a full picture of the revision. So that's our hope.
Okay.
And plan.
Thanks, Allison. So our immediate next steps will be to meet again and pick up where we left off, just to kind of review where these regulation revisions are going to go. So once they're all finished between all of the work groups, they'll be shared with the ESC, which then the ESC will approve, modify, or if it has to, reject some of the other recommendations. And we will continue to have these very substantive discussions around these two. So this is not the end all be all, right? There's still more approval steps to go. We'll also look at the SYTF recommendations that'll be identified by Chair Lucero and Co-Chair Ezekiel Nishiyama. And then hopefully after all of that is all put together, we'll have a final proposed revisions, which we will then share with the BSEC. And then the BSEC will also go through their own approval process where they will look through all of the regulations and the recommendations for revisions. And then the BSEC will vote on those. And then the staff will then begin the Office of Administrative Law process. I got that right, Shay? That acronym. Great. So if there are there any last questions moving forward? No. Okay. Well, if anything does come up, please feel free to email the BSEC regulations at bsec.ca.gov. But other than that, that's it. And we can close out. And again, thank you all for joining. I know, Laura, you're all the way on the East Coast. So really, really just want to say thank you so much for your time and expertise as well.
Thank you guys all so much.
Bye-bye.
Bye, everyone.
Bye.